Hi, you guys. Welcome back for our daily practice questions. It is day 210 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description of this video, and it houses all of the resources that I offer. Now, if you're looking to join the upcoming FMP and AGMP review, it starts August the 11th, runs through September the 12th. We have one more space available, and enrollment closes Friday of this week as class will be starting on the 11th, okay? So that y'all can make sure that y'all have all access and everything that you need to get started. So if you're looking to enroll, make sure you click the link in the description of this video to join. All right, y'all, question number one. A 52-year-old male with a history of MI presents for follow-up. His LDL is 115. He has no medication allergies. What is the best treatment option? Is it A, simvastatin 20 milligrams daily? Is it B, atorvastatin 80 milligrams daily? Is it C, rosuvastatin 5 milligrams daily? Or is it D, pravastatin 40 milligrams daily? Take a moment and tell me what you got, y'all. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you, right? So, what is the best treatment option? And I tell you, if they're asking for a treatment, you need to run it back and see if they provided you with the diagnosis. Um, and they have not in this scenario, so we got to run it back and look at the assessment findings, right? So we have a 52-year-old male, has a history of a myocardial infarction. He's just in for a follow-up. His LDL is 115. So you need to stop here, right? So LDL of 115, we like our LDL to be less than 100. And truthfully, if they have cardiac risk factors, you want it to be less than 70. So this patient is exceeding where you want that LDL to be. They don't have any medication allergies, so we do need to start them on statins. So now you need to ask yourself, what type of statin would you start them on, right? And so your best answer is going to be B, atorvastatin 80 milligrams daily. Remember, that is one of your high intensity statins. And the reason we're going directly to a high intensity statin is because this patient has clinical ASCVD, right? You have a CVD risk factor that you have occurred, right? That has occurred, sorry. Being that they have a history of MI. So they need additional protection. So we're going to give them that high intensity statin, right? All right, question number two. A 60-year-old woman with type 2 diabetes has an LDL of 140 milligrams per deciliter and no history of ASCVD. Her 10-year ASCVD risk is 7.5%. What is the recommended statin treatment? Is it A, no treatment needed at this time? Is it B, rosuvastatin 40 milligrams daily? Is it C, simvastatin 20 milligrams daily? Or is it D, atorvastatin 80 milligrams daily? Take a moment. Tell me what you got, y'all. All right, so stem of the question, what is the recommended statin treatment? All right, so the stem is telling you what we need. We need a statin treatment, but let's determine what we have going on, right? So we have a 60-year-old woman. She has type 2 diabetes, and her LDL is 140. She doesn't have a history of ASCVD, and her 10-year risk factor is 7.5%. All right, now don't let that confuse you. First off, I want you to pay attention to the LDL. What do we want our LDL to be? What is the goal? It's less than 100, right? On top of this, she is diabetic and she's 60 years old. So we know she's going to have to be on something, right? As a protective measure and to decrease the LDL. Remind yourself that this LDL statins work to decrease the LDL. I think y'all get confused because I get questions on this a lot. I think y'all get confused versus total cholesterol and LDL. Pay attention to what they are telling you the lab value is. Total cholesterol is less than 200. LDL is less than 100. But a lot of times questions will tell you that LDL because that is what the statin therapy works on. Statins reduce LDLs. So now that we know that we need to reduce this LDL because she's at a 140 and we want her at least less than 100, right? Then ask yourself, what type of intensity statin would you need, right? Because even if you don't know process of elimination, with the atorvastatin 80 milligrams, that's a high intensity statin. Remember, high intensity statins decrease the LDL by 50%, right? 50% or greater. Moderate intensity statins lower your LDLs from 30 to 49%, and then your low intensity statins decrease it by 30%, right? So ask yourself about how much do you need to reduce this LDL, right? And so it'll be best to go with a moderate intensity statin. So you're getting a reduction anywhere from that 30 to 49%. So then ask yourself which one of these is a moderate intensity statin, right? So your best answer is going to be C, your simvastatin, 20 milligrams. All right, lastly, question number 3. Which of the following statin regimens is classified as a low intensity statin? Is it A, atorvastatin 10 milligrams? Is it B, pravastatin 10 milligrams? Is it C, simvastatin 40 milligrams? Or is it D, rosuvastatin 10 milligrams? Take a moment and tell me what you got, y'all. All right, so here, STEM is the question. The question is the STEM, and it states which of the following statin regimens is classified as a low intensity statin? And your best answer is B, your pravastatin 10 milligrams. Pravastatin 10 is your low intensity statin, okay? And if y'all struggle with these, go check out the statin intensity chart. Um, in the membership, I do a video on that, but I think that'll kind of help you see it. I like to go over that in my review classes and sources just to kind of help with that. But uh, that's a big difference right there, with being able to see all of the ones and what category they fall into. It'll help you approach these questions better. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But as I mentioned previously in the video, my website is also linked in the description of this video, and it houses everything that I offer for first-time test takers as well as those who are retesting. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.